I need to make sure. Can we start right now? Okay. Hello, everyone, and welcome to the Vegan Care panel at the European Vegan Summit 2024. My name is Marzena Cypryańska Nezlek, and I am social psychologist with an interest in many environmental issues, but also in public health and nutrition. And I am also interested in mechanisms of changing food policy. And today we will explore the intersection of veganism and healthcare. And we will focus on the impact of plant-based diets on health and wellness. And we have an impressive lineup of guest speakers who bring a wealth of knowledge and experience in plant-based nutrition and its benefits for health. Let me introduce our guests. It is David Stenholtz. David is oncologist, plant-based physician, and founder of Doctors for the Future. And he is a health activist and author of the book, The Power of Diet. With us is also Shireen Kassam, and Shireen is founder of Plant-Based Health Professionals, and she's a consultant of hematologist and lecturer with a specialist interest in plant-based nutrition for chronic disease prevention and cancer care. And George Hayek, who is the founder of Lebanese vegans and Hayek Hospital. And George has transformed his hospital to exclusively serve plant-based vegan food, tackling chronic disease at their root. Once again, hello everyone, and I want to add that our session partner is Parents for Future. Thank you for this. So let's start our discussion, please. We can start with the basis so that people watching us and hearing about veganism in a health context for the first time can get a handful of good information from professionals. I will ask you now to point out what health risk people whose diet is based on zoonotic products face. And please provide us with your blacklists. And so it is the type of foods and disease they can create. Shireen, maybe we can start with you, please.
Unmute myself. Thank you for the invitation. Great to be here. So as I understand, the focus is really to highlight the negative impacts of consuming foods made from animals and their other products. And really, we have a wealth of evidence that demonstrates to us that a diet that promotes good physical and mental health and well-being is one that is centered around healthy plant foods, fruits, vegetables, whole grains, beans, nuts, and seeds. We know this type of diet promotes better physical and mental health. It reduces our risk of the commonest chronic conditions such as type 2 diabetes, cardiovascular disease, certain cancers, future risk of dementia. And so conversely, we also know that the foods that do not support our optimal health and often create ill health are those that come from animal source foods, which are absolutely not necessary to promote health and wellness. So we know that diets heavy in meat, dairy, and eggs really do the opposite of a healthy vegan diet. So really only to say that we know in healthcare that the best way to promote health and wellness is to center your diet around healthy plant foods. So I'll leave that there as an introduction and let you pass on to another speaker.
Okay, thank you a lot. So now I will ask David, please add what could you add to the list, quite long list that we got from Shireen? If you would like to add anything, I would like to start with this negative, then to leave it behind us and go to this positive. We will be talking about a plant-based diet.
I would say that the disease that is often mentioned when it comes to animal products is cancer. And the animal product often mentioned is red meat and processed meat. However, I would personally say that two very important diseases are often forgotten, and that is obesity and type 2 diabetes. These conditions are often presented to be associated with sugar and ultra-processed food, which is in itself true. But I would say that if you look at what all the diabetes expert panels are saying at the moment, they are to an equivalent amount stressing the importance of reducing animal products, especially in type 2 diabetes. And I think this is a very important point, because if you have type 2 diabetes and your only change of diet is to reduce sugar, you won't come very far. You will improve your results slightly, but to use the full extent of a healthy diet transition, you also need to reduce basically all animal products to a great extent, and then the results will continue to improve.
It is interesting also because what you mentioned at the beginning, that it is not so obvious to people. So usually, as you said, this diabetes is usually associated when people are talking about this with reducing sugar. But of course, people can read about also reduction meat, but it is not so obvious. So I think it can be something, I could call it, new to people to also consider it.
Yes, and I would, in the case of type 2 diabetes, it is a bit strange that this one-sided focus on ultra-processed food is dominant in communication with patients, because it is the animal products and substances in them, such like branched amino acids, the heme iron and saturated fat, that are causing the insulin resistance, which then leads to type 2 diabetes. So to reverse type 2 diabetes, you need to take these food items away. And the processed food has other negative impacts. If you have type 2 diabetes, they will create insulin curve that goes up and down, and they will also make you more obese, which is also negative. But the actual cause of type 2 diabetes is from animal products, and this is, I think, this needs to be communicated much with much more stress.
Yeah, I agree with you. And it is, I now I realized when I was listening to you that, wow, I just forgot about this, or maybe I did not put attention to this. So I think it is really important. So thank you for this. Georges, would you like to add anything from your experience and practice to the whole list we have now?
Sure. Well, being owner of a hospital, I can tell you that, well, it's true that the number one cause of disease in the human is heart disease, unfortunately. And if we listen to all cardiologists, MDs, they all stress on the fact that diet high in cholesterol and saturated fat promotes clogging arteries and promotes heart disease. So when we know that, well, cholesterol is only found in animal products, And when we know that saturated fat is much lower compared to in a plant-based diet compared to an animal-based diet, well, the writings are on the wall. I mean, it's very clear what we should not be consuming in order not to promote diseases and having like chronic diseases and cancers later on. What we eat will only but show, if not today, tomorrow, if not tomorrow, later on. But eventually, the fuel that we are injecting in our body will only but show at the moment in time. So if we want to prevent getting sick and dying early, whether us or our beloved one, we should well remove animal products from our diet. Whether, like Dr. David mentioned, is the heme iron or saturated fat or the cholesterol, they're all packed in one package. So in order for us to, first of all, try to stop the evolution of diseases and try to reverse them, one diet suits basically all types of people and all diseases as well.
Oh, thank you. Thank you for this. It is only a few minutes, actually. I mean, maybe I just did not measure time, 11, 10. And you listed just quite long list of these negative effects of this diet that is based on meat. And I have impression now that I just, when I was listening to you, I tried to imagine what people can think when they are listening to this. Of course, for vegan, it is nothing surprising but I thought about people who love meat, what we sometimes called omnivores. And so it was one thought what they can think, because I think it is quite even scary when we are talking about this. For sure, it is surprising. But the second reflection was how it is possible that we do not put attention much more to this. No, we can refer to traditional diet and things like that. We will not discuss it now, but I just wanted to present you what I thought when I was listening to you, and I tried to take perspective of regular people. And also, I thought how it is important to communicate it. So, okay, we started with this negative to scare all of us a bit, or just rather just alarm. But now let's go into this more positive way, no? Because when we are talking to people, okay, it is not good. It is not good for our health. We need to give them something instead. And in many cases, is that people hesitate. They do not want to change the diet, not only because they like meat, but they do not know what can eat instead. But I also think that what is important, they are many times not aware of what benefits they can have from eating. I think it is even more important. So I ask you now, just let's go to the area of plant-based diet, and let's talk about these benefits that we can have from this, because it is something that can attract people. Will we start with the same? So maybe Shireen, please, if you don't mind.
Yeah, thank you. I think I sort of started answering this question in advance, really, but only to say that sort of within the healthcare profession, we like to frame things in a positive way, and we want to talk to our patients about what they add in to the diet to improve their health, rather than talking about taking things away, because people often feel defensive when you say that they need to remove things from their diet when it's been so much a part of their cultural and traditional norms. So, you know, in the clinic space as doctors, and I'd be interested to hear what David says, you know, we always talk about adding more fruits and vegetables, whole grains, beans, nuts and seeds, to crowd out all of those foods that we've just said are going to negatively impact health. And the kind of good news is that, like with everything, in medicine, there's a dose effect. As soon as you start incrementally increasing, you add in additional benefits. So any small change is good, but if you're able to make the sort of maximum change of, adopting a fully plant-based diet, then all of those health benefits, both to your physical, mental health and well-being, are up there for grabs. And the good news is that it's never too late. You can always improve your health, even if you've got into a tricky situation like already having heart disease, like George has talked about, or, in my specialty and David's specialty of cancer, you can always make improvements. So I think it's nice to stick with that positive message of, knowing that eating more plants improves your heart health, your brain health, reduces your risk of cancer, keeps you a healthier weight. And it seems to have all these knock-on effects on making you feel full of energy and better skin, things that may not even be present in the medical literature, but people report to you when they make these changes. So I think, as you say, it's really great to frame it in a positive light. And as people start to experience those positive effects, they want to do more and more and add more and more variety to their diet and try these new plant foods that they may not have even had as part of their diet previously.
Okay, thank you. And you mentioned about this, something very important, how to motivate people, how to encourage them to not eat meat or reduce meat, and how to include more plants in their diet. Allow me to mention, I was doing research on motivation and veganism and just generally diet and what motivate people that they stop eating meat, for example. And it'll be nothing surprising when I will say that the most important factor was health, then environment, and finally was ethical reasons why people decide to reduce or stop eating meat. So referring to what you said, I think just we are talking about it. I mentioned about this before. This health issue is really here important, but you underline the fact that it is also important to attract people with telling them what is positive about and what they can benefit from this plant-based diet. So thank you for this. And again, David, what is your perspective, or what you could add, or what do you see based on your experience as very important, or to what people react in this area of benefits?
Well, I usually frame my, when I inform patients, I say two things. First I say that we know today what foods are good and which are not good. There's not a confusion among scientists. There's no confusion among expert panels. The Swedish Food and Health authorities are saying the same thing as the World Cancer Research Fund and the same thing as the American Heart Association. So that's the first very important point. And the second equally important is that the food has a fundamental and strong impact on our health. Dietary change gives you power over your health in an extent few people are aware. And but if you want to, take advantage of this great opportunity, you have to make an intensive dietary change. You have to center basically all your meals around whole plant foods. So that's how I frame it, and I make sure to inform patients, especially patients who have cardiometabolic diseases such as cardiovascular disease, hypertension, obesity, type 2 diabetes. These conditions will reverse among the majority of patients who are making big and substantial dietary changes. And I find it's the only ethical thing to do when this knowledge is there, not to inform patients about this. It's not an option. And when people are saying that they don't want to give up meat, that's the most common objection is that, but some react in disbelief and say, but we've always eaten meat. And then I answer, yes, it's true, we've eaten meat since the Stone Age, but the Stone Age ended, and it didn't end because we ran out of stones. It ended because we learned new things, and we used this knowledge to change our behavior. And now we have over 100 years of published research are telling us that this meat is bad for us. So why don't we just stop eating it?
Yeah, I mean, yeah, of course, it talks to me and it seems to be so obvious. But thank you for this example because, of course, I always, I mean, my father ate meat, my grandfather, usually people are talking about this, and I am also omnivorous. So they refer to some tradition to that it always was, and sometimes people feel they are lost and they do not know how to answer, no, because it is true, it was also, but it is quite interesting what you said with this area, that it is hundreds of years and something has changed. What you mentioned about it also refers to the problem with stereotypes. I just put attention to the fact when you said about energy. Many times people have these schemas that they think that if you need energy, you need to eat meat, whereas plants, there is for children. However, children actually also need a lot of energy. So I think that sometimes what we need to cope with is also these stereotypes that people have some association that not necessarily represent how reality is. Georges, I have also some question for you. The next one will refer to your experience in your hospital, but before I will put the question, would you like to add anything to these benefits and maybe how to talk to people to show them the benefits?
Well, of course, going back to your previous question, how to talk about veganism in a positive way. Of course, we should always find a positive way to have the message go through. But first of all, we should state the facts. We can't run from the facts and tell things as they are about the dangers of consuming animal products. This being said, we should educate as well. I can give you an example from my hospital. I have a lot of patients, as you mentioned, they are used to be eating meat and their parents used to eat meat, and it goes from generation to another, part of tradition, part of culture. And whenever they realize that in the meal that you are presenting them with, there is no meat, there is no dairy, there is no eggs, they start questioning and inquiring why the meal is meat-free, animal product-free. So here comes our role of educating and try to forward the message in a positive way. We have our vegan dietitian who is responsible to, while conducting her visit, to educate our patients, to educate our visitors as well, families, on the real source of nutrient. Because the marketing has done such a very good job into making people think that, well, protein equals meat and calcium equals dairy or milk, which is completely wrong. So we go back to the source of education. We try to educate people that, listen, if you ever consume meat, of course you're going to be getting protein, but it's going to be a recycled plant protein first, and you're going to be having all the nasty stuff as well. Whereas if you go directly to the source, well, protein is found in everything that we can eat, all the greens, everything that is found in a plant-based diet, we can find protein. So it's not something that we should worry about. Same goes to all amino acids. Same goes to calcium. We are not supposed to be drinking cow's milk to be having strong bones. well, education is a very positive way to forward the message, and not just by lecturing people or lecturing our patients, but in my hospital, we try to find entertaining ways to educate our patients so that the message will be even more positive as well. So we try to find like games to show them to our patients and try to ask them questions with nutritional facts and things that they are not aware of, such as French fries does not contain cholesterol because it's only found in animal products. How much saturated fat can be found in steak, and people are intrigued, and hence they start learning in a nice way. You know, not just try to bash them or try to be like harsh on them. And like you mentioned, people don't like to be told what to do or what to remove from their diet because they are used to such kind of food. So whenever you try to just tell them, listen, you have to remove animal products without giving much information, it will not go through. Whereas when you try to give facts, educate, present with studies and all important facts that you are facing today, putting them in a nice, entertaining way, so that they would be more prone to accept the message. This is how we do it over at our.
Yeah, what you showed a moment ago, it refers or it is related with something very important, that some factor that help to motivate people to change behavior or just change their minds. It is curiosity. It is, and it is also creativity, curiosity, and very important, you allow them to find out the information themselves, to figure it out, not that they are only told it is this and you need to do this. It is, people do not like, as you mentioned, to be forbidden or to be forced. So it's quite interesting that they seem to be that it is their decision and their choice. Yeah. So I found it very interesting. Yeah. But of course, it is effort of your part. And now it is a good moment to put another question that I plan to ask about. Georges, you are, we can say, pioneer and have succeeded in this great way. I'm talking about your experience that is still for me unbelievable, I need to tell you. That is, so the question, I'm talking about hospital and your idea that you run this, I would call it vegan revolution. So how was it possible that you change the diet in your hospital and it is, we can say, vegan hospital? That seems to be, I think that for most people seems to be not possible. I mean, I try to imagine it in some hospital I know here. So how? I mean, I saw these plates, so I can have some imagination, but please tell us about your experience.
The thing is that we should really believe in the power of change, and we should really believe in the power of changing grassroots level, at the grassroots level. I mean, we can take my humble experience. I turned vegan for ethical reasons because I witnessed what happens in slaughterhouses, and it turned out that it doesn't reflect the person that I am. So this is when I decided to stop consuming animal products. Being said, I turned myself vegan, and I started like doing more research on the topic. First, it was obvious from the ethical reason why we should be all vegan, and then well, it turned out that all major and deadly diseases, they come from eating animal and their products. The pandemics as well, not just, but one of the biggest impactor of climate change is animal agriculture. So while doing my research, I figured out that for all those reasons and more, it's only logical for me to turn vegan. And then I wanted to promote what I just acquired, and I figured out that I should apply in my line of business. And since I'm fortunate enough to be owning a hospital in Beirut, I decided that I cannot be talking in a way and doing business in a different way. So this is when I decided to implement veganism or a plant-based diet, a fully plant-based diet at the hospital. How I did it? Well, with a lot of training, conferences, seminars, documentary screenings, to the public, of course, to my internal team, nursing team, doctors as well, administration, so that the whole hospital and its staff would know exactly why Hayek Hospital took this decision, based not on emotions, not because the owner of the hospital turned vegan, not because he's an ethical vegan, but because he has data and evidence-based data at hand that he presented, and having those facts out there was for me some kind of a defensive tool or mechanism to be able to go fully with my decision. Whenever I was faced with some criticism, my defense tool was not emotions, but facts and studies. When cancer research classified meat as carcinogenic in a general term, being more specific, processed meat group 1A carcinogenic, same group as tobacco, which causes cancer. So I found it completely absurd. How can hospitals still be serving processed meat like ham and bacon and sausages and whatever to their patients when it has been classified at the same group as tobacco? I mean, it's obvious. We don't need to do like many profound studies or whatever to figure out that well, processed meat or meat in general has no place in hospitals where we are supposed to be treating people that suffer from diseases and cancer. So in this way, I was able to do the shift at the hospital. Of course, not all my staff or the patients were convinced, but at least while presenting them with facts, it was like obvious, even though they were like reluctant a bit, but this was the case, and I went through. It's been like 3 years now that we've applied and adopted plant-based diet at the hospital. So far, it's doing great. Of course, we had some people, some patients who are not happy, but again, while educating them, things change. And basically, the mission of the hospital by turning vegan, we know that not all our patients will go back home and be vegan, but at least we try to plant the seed in those patients and their family to go back and home and try to think, I mean, if there's a hospital that doesn't serve this kind of food, maybe there's a valid reason for that, and give them the opportunity themselves. Like you mentioned before, they are the one to come up with the answer and the decision. We are not here to impose anything. We're just here to inform and educate, and the decision and the research mainly should come from within.
Thank you. Actually, I need to tell you, I would be happy to comment it and also to continue this discussion. But I look at we have not much, not enough time. So I hope that we will have another occasion to also continue this description, because it is really interesting, this experience, how you were able to change the diet in the hospital you work in. It seems that the change we are talking about, I mean, this change to the plant-based diet, will not succeed without doctors. I mean, when we are talking about health, what is good for health, what not in this context, no, then it is not possible without a doctor. So what do you think, how it is possible to raise awareness and educate doctors, and what can be done to ensure doctors to understand veganism and start incorporating it into their medical practice? I I started with this, how to raise awareness of doctors. And I said it intentionally. I mean, I know that the awareness of doctors is not so high. Am I right? I mean, maybe now you can choose. I will not pick up you, please.
I can confirm that the majority of doctors are very far from nutrition. I mean, they are supposed to know a lot about nutrition because this is what causes diseases and cancer in the first place. But unfortunately, they have no clue whatsoever. They don't know that cholesterol is only found in animal products. They don't know that that animal products has zero fiber in them. I mean, the basics they don't know. So what can we expect from them other than a prescription and a lifetime of treatment?
Yeah. Yeah. Oh, okay. So it is what it just corresponds to what I thought about this also with my experience. Shireen,
yeah.
from your
So
perspective?
I agree. I think I agree with you that we are not going to realize a vegan world that we all desire unless and until we convince the healthcare profession that this is a desirable, preferable way to live on this earth. And I think that's why individuals like myself and David spend our time trying to fill that knowledge gap that Georges refers to, because it's not a doctor's primary job to talk about diet, and maybe it should be, but that's not how we're educated. Yet we all feel that we understand what a healthy diet will be, and then bring our own biases along with that. And the trouble is, we live in a society, most of us live in a society where animal-based foods are normalized everywhere we go. And so as healthcare professionals, we need to support wider society to recognize that it's much more preferable and normal to prioritize plant-based meals. And I think, that's where we can, I feel like myself and David can make a real contribution to the vegan movement. And I can talk about what we do in the UK. We try and fill that education gap. We do offer courses. We're now teaching in medical schools and dietetic courses. We often offer CPD webinars and conferences. So it's hard work and it's uphill battle, but at least, we can do our best to raise awareness. And like Georges has done in his hospital, normalize what we want to see in wider society. So, in my hospital, it's still normal for most people to be offered a meat-based meal in a hospital. And what we're working towards is trying to flip that norm. And I think until it's acceptable to all the healthcare professionals, then we're not going to see the widespread adoption of veganism. Now, I just want to add the caveat, and I'd be interested to hear what David says. It's very hard for us as doctors to talk about veganism. So I think we can talk about plant-based diets and health. Increasingly, we're expected to talk about the climate crisis because we understand that the climate crisis is the leading issue affecting human health as well, but it's very difficult to start and expect our patients who have got such serious conditions to then start talking about veganism, the animal slaughterhouses. It doesn't always feel appropriate. So I think healthcare professionals can definitely normalize a vegan diet, talk about the climate crisis, but I personally kind of leave the animal rights issue to all the amazing groups out there that are fighting for the rights of all animals.
Thank you. I wanted just to add or maybe ask you about this because we are talking about this awareness, and maybe to be question to you, David. We are talking about raising awareness, and mainly we are talking about this not school. We are talking about some seminars, how activists educate, how people do it themselves, but I do not have experience in this, but how it is this university education when doctors are at the university. What is about this program? Because actually, I think that when we are talking about this awareness, it is the place when they should start. So they should not need seminars somewhere in conference like we have now, for example. But what is with this the standard education at the university level? David, maybe it is okay for you to answer this question with your experience. I cannot hear you.
Sorry, I didn't hear the last sentence. Sorry.
Okay, can you hear me now?
Yes. I heard everything, right. Not just the last sentence.
So just to make it shorter, I was talking about this awareness, and now the question was about university program and to what extent young doctors, I mean students of medicine, yes, can be familiar, or I mean, what is in the program?
In Sweden, not very much, but I would say that the knowledge we're talking about now, how food affects your health, is a part of the subject nutrition. And the second part of nutrition is what vitamins do you need and where can they be found? And this first part, it's not only doctors that doesn't know this, no one. No one in the health sector knows this. Dietitians doesn't know this. They are not taught about this. They're only taught about the second part of nutrition, how to get vitamins. So everyone needs to be educated. Personally, if you're going to make a priority list on how to best reach out, I would not start at the university. Universities are very, at least in Sweden, very high bureaucracy. It's very difficult to change the curriculum. Every clinic is fighting to get their piece of the curriculum and to get nutrition into there. It's a very hard struggle. I think the best priority, the number one, is to reach primary health care practitioners who are in the clinic now. That's what I'm personally are doing at the moment. I'm currently working at a primary care clinic here in Sörmland, the region border south of Stockholm. And I have just basically invited myself to all other primary health care centers and presented my experience, and that I've written a book, and more than half of them have accepted. So, and what happens when you present this data of intensive dietary change, of plant-based diet, is that many people awaken and take action. Because the people who are at primary healthcare centers are people who care about their patients. They want to make their patients healthier. And if you present them with this extremely powerful tool that they were unaware of, they will awake and they will start using it. And strategically, every primary healthcare worker needs in Sweden about 2,000 people every year, which means that if you talk to 20 of them, you have the potential to spread this knowledge not to 20 people, but to 20 times 2,000. That's 40,000 people you are reaching just talking for 45 minutes. It's extremely efficient outreach. So that's what I'm doing at the moment, and I can't know for sure, but I'm quite confident it will reap some benefits in the future. We'll see.
Yeah. I started talking about this, what should be when I was talking about university education, but you just mentioned about how reality is and how we need to adjust to this. So, I mean, we can dream about something, but if we want to change, we need to take the life as it is and try to do what we can with this.
Sorry,
Okay.
Another important point about universities, it's not only difficult to change the curriculum. If you start there, the students are there, they will be physicians in 10 years. So basically, they won't spread this information for the next 10 years. But so if you have a priority list, if you're an NGO like the health professional, club-based health professionals in the UK, or us, the physicians for the future, I would personally not prioritize the universities if you have limited funding, but first go for the people who are in the clinics now, and then choose the universities if you have any spare time, which you won't.
Yeah, so maybe this is some long distance dream, but now we do what we can and what is effective. I understand. Thank you for this. I have for you two more questions, and we were talking about negative effects of meat diet, and then benefits, and then awareness, or rather raising awareness. And now I would like to move to a bit different area, however, still associated with this plant-based diet or zoonotic diet. There is another side of the impact of the animal agriculture sector, and this impact on human health. And here I'm talking about something like that. We know that a lot of people are living in the vicinity of what is called factory farms, and we have data that show it is not good for their health. And in this case, I would like to, especially for our audience, to provide some information to. I would like to ask you about research. I mean, what we know from research, and how might be the scale of the problem. Once again, I'm talking about the impact that factory farms have on human health. And I'm talking about people who are living in this vicinity. And here maybe one of you would like to start talking about this. I do not know what is your experience and to what extent it is your interest.
I do not have the... Sorry, go on.
I'm happy to kick off if you want, David. Shall I start and you can comment? It's not a specific area of expertise, but clearly I've done some reading around the topic. I think there's two groups of people that are harmed from the factory farming. There's obviously people who work within the system. We expect our fellow humans to work in slaughterhouses, and there's extensive research showing that these individuals, nobody grows up wanting to be a slaughterhouse worker. So of course they are marginalized people who have no other choice, often, migrants in their country that have terrible working lives, and therefore have significant increased risk of physical and mental ill health, and also negative social behaviors. They often develop sort of violent behaviors in their own homes as well, having had a workplace that's ultimately filled with violence, having to kill other animals. And then, as you mentioned, there's a lot of research around the harms of factory farming to the residents that are living close by to these farms. And again, these farms are often located in the poorest areas, by design. People who have adequate means are not going to be buying houses next door to a slaughterhouse. So it compounds the health inequalities. But we do absolutely know that the waste products, the pesticide use, the excess species accumulation from factory farms is polluting our air, water and land, and it's affecting all of us. So of course, if you live close by, you'll be suffering with the consequences of high levels of air pollution that we know increases your risk of cardiovascular disease, type 2 diabetes, and cancer. We know that there'll be pollution of the water and the risk of diseases transmitted in that polluted, species-ridden water. And similarly, the land is also contaminated with feces and antibiotic-resistant bacteria that may then contaminate even the plant foods. But even at a distance, you know, we had a study from the UK just last year demonstrating that in our big cities, around a third of the air pollution came directly from the farming sector, and it was predominantly from animal farming that this air pollution. So, you know, we all talk about air pollution being a major global problem, which of course it is, but actually a significant amount of that air pollution from nitrous oxide and methane and ammonia is actually coming from animal agriculture. So those are just some headline messages around the harms that are caused by this industrialized farming system, certainly the animal farming system that we have created globally.
Yeah, many times in people's imagination was, now it's less and less, but the first issue is smell. Sometimes people are talking about the smell and they are not really aware, majority of people, about what you said now about these other factors that are associated with farming and how it can impact people's life, not only people who are living nearby. I think that interesting is what you mentioned about these more distant places, because many times it is that people who are living near a factory farm, they do not get enough support because it is their problem, what we can do. But actually it is probably, now when I was listening to you, I thought from the psychological point of view, it is very important to show that actually it refers to all of us, even when we are talking about this like air pollution, soil, and things like that. David, Georges, would you like to add anything to this?
Yes, I don't have the numbers on the top of my head, but I do know there's studies made in the US about foodborne particles, and the death toll is in the range, hundreds of thousands of people who are dying in the US due to airborne particles that are released. And you don't need to live near to these travel thousands of miles. So you have a direct health cause from animal products, but this is what we can call indirect causes. The health hazards of the production is a long list. You have also that factory farms are the basis of future pandemics. Professor in Sweden has said repeatedly during the pandemic that if everyone went vegetarian, there won't be another pandemic. Pandemics will arise in the animal factory farms, where especially among chicken and pigs are the greatest risk that influenza has a great potential to mutate and spread to humans. And the third one is antibiotic resistant bacteria that currently is being spread from animals, especially chicken and pigs, also to humans. You buy them and then you get them when you prepare. There have been several outbreaks in or there has been spread in Sweden, and then I can mention 4 or 5 more, but the important one is of course the climate change, which has obviously is bad for our health. If there is heat and droughts and overflooding, and the animal food sector is a big contributor.
What you mentioned now is just this indirect effect that is not always easy to inform people about, because they're usually most sensitive to these direct causes. Yes, it is stimuli and it is effect. But anyway, thank you for this. And this list is very long. David, you mentioned about antibiotic resistance, and actually you jumped to my last question. So allow me now, maybe I will start now with you, Georges, that I will jump to this another question, but if you want to add anything to the previous topic, feel free. The next question is about, and actually the last one, antibiotic resistance. So what should we talk about, or rather maybe again, I will ask you about scientific data and about some your experience about this, and about this animal agriculture sector is still one of the big pharma's best customer. So what does this problem look like in research? What is the scale, and what do you think requires the special attention in this regard?
First, let me tell you that Dr. Shireen and Dr. David covered very well your previous question with all the dangers of factory farms, covering pandemics, of course, when the CDC states that more than 75% of all pandemics they come from animal agriculture, zoonotic diseases. So this is a major problem. Of course, what David mentioned as well, antibiotics resistance, because as we all know, factory farms, they inject all their animals with antibiotics, because if one animal is sick, all other animals will get sick as well. So this is like a preventative mechanism, which will eventually cause resistance. So our next big like pandemic or epidemic will be not it will be a very like silly flu, a normal flu in a couple of years or in a few years ahead. Won't be curable the way it is cured today with the antibiotics that we have today, with the generations that we have today. So it's a very serious matter we should take into consideration. We are heading into a very serious problem, that is. So whether it's the psychological effects on the workers, as Dr. Shireen stated, they all suffer from PTSD when they go back home and try to live a normal life with their family while slitting throats all day. This is terrorism that we're subjecting those workers to. Whether it's the methanes or the CO2 that those factory farms are producing and damaging our ozone as well, whether it's the pandemics, whether it's the antibiotics resistance. And another thing as well, there's this argument that the non-vegans try to debunk veganism and try to tell that even like your plants and crops are infected or something. There's this Roman lettuce scandal that they were infected with the salmonella. Well, it's not the lettuce that produced salmonella as much as it's all the feces and the waste of those factory farms that went through those rivers, and the lands got irrigated by those water, and hence those lettuce got affected by salmonella. So we always go back to the root cause of problems, animal products, zoonotic problems. This is the problem.
Okay, thank you a lot for this. We have like 1-2 minutes more, but I would like to ask you also, Shireen and David, maybe you would like to add something to this topic.
Well, only just to add some facts and figures that currently 70% of antibiotics we use are used in animal farming. So, if we want to do the best we can to reduce our use, we should stop farming animals and stop eating them. And then to say that the problem is a problem right now. So the latest study I've seen tells us that 1.3 million people in 2019 died of antibiotic-resistant infections, and this problem is only rising. And this is killing more people than malaria and HIV combined, and yet we talk much more about HIV infection and malaria than we do about this rising burden of antibiotic-resistant infections. So, it's already a problem at a huge scale, and we shouldn't underestimate the problem we've created.
Okay, thank you, Shireen. David, 1-2 sentences. Could you add something?
I think my colleagues have covered this subject, so I don't think I have anything more to add.
Okay, thank you. Thank you it was really great to me. I think the same for audience to listen to you, and I could learn a lot. And now we have 14 minutes for questions from people who were with us here. And I have the questions. I need maybe a few seconds. Answers. Okay. Forgive me, I need some help from organizers because now I feel a bit lost. I have a lot of questions here from people who are listening to us. So maybe I will just choose one of them. And I have some comment. Thank you, Mr. Hayek. This is true 100%. In addition to the damage to the planet affecting the climate, 70% due animal farming related to deforestation and the use of machinery. But I see, sorry, that it is not really, it is just only for you that someone agreed with you and wanted to continue this topic. I do not have so many questions that they were not answered by our organizers. So maybe to use these 10 minutes we are left, I would like to ask you to, when you were listening to each other, would you like to add anything to this topic? Maybe comment each other, please. I did not allow you to discuss with you, so maybe now let's take this moment to do it.
I would like to take 2 minutes to share something.
Okay.
Lying here beside me, just a little tip for everyone who wishes to educate both patients and health professionals. We have, in the region where I worked, I have developed a miniature poster that looks like this. And basically what it is an image that shows what food items are best for your health, and going down it gets worse and worse. So you have whole plant foods at the bottom, and then all the way down to red meat and processed meat, sugar, and etc. And this has been extremely effective for many reasons. One, that this is an open image. It's not closed. It's not like a plate that tells you what to eat. This image simply informs you what food items are good and which are not. And secondly, it's 100% in line with the Swedish health authorities, American Heart Association, etc. But it also opens for the opportunity to give dietary advice on a whole food plant-based diet, as you can see at the top. It also reminds you of taking B12 if you do. But the format, I must stress, it's very important. It's just one miniature poster, and this is a great advantage in comparison to a leaflet or a brochure. A brochure is at best read by your patients, and then normally thrown away after a week, maybe. I have asked patients who come back to me, and I know that I've given this to them, but I still ask them, by the way, did I give you this last time I was there, last time you were here? And 8 out of 10 answers, yes, it's on my refrigerator door. So please feel free to copy this idea. It has been tremendously successful.
You're muted. Marzena, you're muted.
All right. We have like 7 minutes still, and allow me to tell you about my experience that I mentioned about this. Need to tell you that during the whole our discussion, I still had in mind, it just appeared in my mind all the time, how it is possible that we have still the majority is omnivores. How it is possible that it is not common knowledge? And I ask myself, I am a psychologist and I do a lot about communication, about education, but need to confess that I stopped eating meat because of ethical issue. I studied dehumanization and somehow it happened. I simply cannot. I mean, health, not health. But it is not the factor that the most important factor that make people to just stop eating meat. Based on your experience, let's assume it is unbelievable that people still they eat meat. Now it will be the question, how to inform people, how to communicate, now I'm talking about this education and communication based on your experience. So David, you mentioned what we can use from your experience, but based on your experience, what would you advise? I am like communicator. I want to now convince people. No, I do not want to convince them. I want to talk with them, inform them, and then allow them to make decision themselves. I think it is the problem that we want to convince people. Yes, no, I want to talk with them and allow them to understand. Please give me some advice. What should I start with? What do you think that hit people? I mean, now it will be summary, but because actually you were talking about this, but as a summary.
I mean, I would start by saying we need to understand what motivates that particular individual, because it's not about us, is it? It's about trying to get through to what motivates, what's important to that person. So I mean, I don't need to tell you as a psychologist that you have to use some techniques around motivational interviewing and to understand that person. And as you say, if it's health that motivates, you go down that route. If people, claim to be animal lovers, you talk about your companion animals and how wonderful they are and how you could never think about eating them, for example. Or if you know that many young people are motivated by climate anxiety and the worries about their future, rightly so, and you go down that route. So I think, for me, you have to really understand, but also I think you have to acknowledge that if people aren't ready for change, it's probably not worth wasting your time on that one particular individual. You have to really recognize who is ready for change. And just going back to your opening statement about why are we in this situation that meat is still considered normal and desirable. I mean, you only need to look back at the smoking and alcohol industry. It's just that industry playbook of keeping, meat relevant to the majority. We understand clearly that governments support meat and dairy farming. We understand that the banks bankroll them. We understand that the industry buys the expertise of scientists and doctors to do their work. You only have to look at the fact that doctors used to smoke and advertise cigarettes, but now instead, they are still promoting meat for protein and dairy for calcium. So I think, there's so many complicated factors that keeps meat normalized, and we have to understand that industry playbook to really counter that, because it's not down to the individuals. We often make the default choice. We don't choose to, cause harm or harm ourselves or the people around us. But yes, I think we need to fully understand what that individual's motivation is and try and remind them of that, because it's only when we all adopted a vegan diet for the ethics, it's only when you remember the animals that you know that you could never possibly go back to eating them.
You mentioned, I know, techniques. I do not care about psychological techniques. I mean, techniques are for nothing when you do not understand, and this understanding from practice, from understanding people. So I just think about meeting people and talk with them. I do not need techniques. Doesn't work. So thank you. David Georges.
Yes, I think I answered your question partially and took some time to make commercial for this little bit. So I'm eager to hear George's contribution to answering this question.
Thank you, David.
Thank you.
Well, listen, in my humble opinion and through my years of activism, I figured out that why the movement is not making some progress. I've thought about it. I think maybe because we have so many different approaches tackling veganism. Have from the apologetic approach to the unapologetic approach. And this creates like a confusion to non-vegans. They would perceive us as not a very serious group of people with not a very serious cause. I mean, if we look to any other injustice, that is, you don't see any apologetic activists or approaches to any other injustices. They have a clear message that this is wrong. We can talk about child abuse, about domestic abuse, about racism, and what more. If we want to try to change the world into becoming a vegan world, maybe we should change our approach. Maybe we should have a clearer approach, to be true to ourselves, to the person in front of us, and view veganism not as a health benefit, although it has some health benefits, of course, as we just mentioned. Not because it affects the environment, although it affects the environment, as you mentioned, but because it's a social justice movement. It's about justice, and it's about the injustice that us humans are inflicting to our fellow earthlings. So having a strong message, a clear-cut message, in my humble opinion, we might have a better result.
Thank you for this. I mean, it's very interesting, important point. You are talking a bit like unity. I mean, this power that people have when they thought the same, when they have one message. By the way, I think that when I was listening to you and about your experience in your hospital, I put attention to this power that you had from your faith, from your belief in what is good, what is not, that you really believed in this, and you did it not only base your thoughts, reasoning, but and somehow I connected with this, what you said now. We as a group need the same, but we need to also have the power from our message to be on the same side. That I also feel not always is the case. So then when we have different voices, it is difficult to talk with people. I still avoid, please notice, convince people. So thank you a lot for this very interesting discussion. It was very interesting to me, and I hope and I believe that also for people who are here with us. So thank you to our panelists. Thank you for sharing your insights. And it's evident that plant-based diets play a crucial role in promoting health and wellness. But we could talk also about some also other issues, like how to talk with people, how to spread it, and also about this that I really appreciate, that we need to think maybe also about us. When I'm talking us, people who identify who are vegans, for whom it is important to change the diet and also care about animals and whatever our motivations are. I encourage everyone to continue supporting this effort of our speakers, and to advocate for the integration of plant-based nutrition in healthcare systems. And of course, we all repeat the same, but I will repeat it again. Of course, together we can make significant strides toward healthier and more sustainable future. So thank you for joining us at the European Vegan Summit 2024. And at the end, go vegan and stay vegan. Thank you a lot.
Thank you.
Thank you.
Bye-bye.